but in general, a blood pressure of about 130/80 would be a good blood pressure. Understanding that it may be lower and it may be a little higher, and that's okay. But the important thing is to follow up with your PCP, make sure that you're getting it checked, and making sure that it's under control and that you're not having sustained elevations in your blood pressure.
Excellent. Dr. Chaudhry, which matters most? We talked about the top number, the bottom number, top number being systolic, bottom number diastolic. So what is important, or which matters the most?
That's a great question. And I think to answer that question, I'll try to summarize very briefly what each number really means. The top number is the pressure when the heart is beating into the artery. And as you can imagine, as we get older, smoking, things like that make the artery stiffer, so the pressure generally is going to be higher. The bottom number, also known as the diastolic pressure, is when the heart is relaxing and what the pressure is in the blood vessel. Once again, as you get older, the stiffness of the arteries can make that pressure higher as well. The thing that we've learned over time is the top number tends to correlate an increased risk for things like heart disease, kidney disease. So therefore, both numbers are important, but I do recommend that we also pay close attention to our top number as well.
Hello, listeners. As you know, Doc Talk Live is a health show dedicated to educating its listeners about different health topics every week. And we do so by bringing on medical experts to answer commonly asked questions. Be sure to send in your questions on Facebook Live, on our Doc Talk Live Facebook page on Wednesdays at 5 p.m. And you can find more information about the show, obviously on Facebook, but also on Instagram, Twitter, YouTube, and our website, doctalklive.com. We also have podcasts, so you can listen to these episodes on platforms such as Spotify, iTunes, and iHeartRadio. Folks, my name is Dr. Parin Makadia, and I'll be hosting today's show. And today we will be discussing high blood pressure or hypertension, the medical term for high blood pressure, which is a condition that affects nearly half of the adults in the United States. And many of these individuals affected don't even know that they have high blood pressure, and they don't even have any symptoms of it. But joining us today are our guests from across the country. We have Dr. Mallory Holmes and Dr. Rad Chaudhry, nephrologists. Welcome to Doc Talk Live, and thank you so much for volunteering your time to be part of this show. Please tell our listeners a little bit about yourself.
All right, thank you so much for having us here. My name is Mallory Holmes. I'm here all the way from California. I specialize in nephrology at Stanford Healthcare, so I'm really excited to join you.
Hi, everybody. Thank you for having us. My name is Rad Chaudhry. I'm the Chief Nephrology Fellow at the University of Pittsburgh Medical Center. So I'm excited for today.
Excellent. Thank you so much, folks, for coming to Dallas and being part of this show. So let's get right to it because it's a very hot topic. So Dr. Holmes, I'm going to start with you. So if one of the listeners were in your office and saying, hey, Dr. Holmes, what should be my blood pressure goal to be, what would you say to them?
Sure. So, blood pressure is very dynamic, but in general, a blood pressure of about 130/80 would be a good blood pressure. Understanding that it may be lower and it may be a little higher, and that's okay. But the important thing is to follow up with your PCP, make sure that you're getting it checked, and making sure that it's under control and that you're not having sustained elevations in your blood pressure.
Excellent. Dr. Chaudhry, which matters most? We talked about the top number, the bottom number, top number being systolic, bottom number diastolic. So what is important, or which matters the most?
That's a great question. And I think to answer that question, I'll try to summarize very briefly what each number really means. The top number is the pressure when the heart is beating into the artery. And as you can imagine, as we get older, smoking, things like that make the artery stiffer, so the pressure generally is going to be higher. The bottom number, also known as the diastolic pressure, is when the heart is relaxing and what the pressure is in the blood vessel. Once again, as you get older, the stiffness of the arteries can make that pressure higher as well. The thing that we've learned over time is the top number tends to correlate an increased risk for things like heart disease, kidney disease. So therefore, both numbers are important, but I do recommend that we also pay close attention to our top number as well.
Excellent. So, Dr. Holmes, CDC estimates that one in about five American adults have high blood pressure, and they don't even know it. So, if someone has it, how would they know?
Yeah, that's the thing about blood pressure. You may not have any symptoms whatsoever whenever your blood pressure is elevated. So the important thing, check your blood pressure, whether it's at home, at the drugstore, at your doctor's office, and just make sure that it's at an acceptable level.
So, Dr. Chaudhary, is there an age at someone that should be checked for high blood pressure? An age limit, perhaps?
Yeah, so recently in April, the United States Preventive Task Force released their most up to date recommendations, and they do recommend yearly screening above the age of 18 if you have no diagnosis of hypertension or high blood pressure. And interestingly, if you read carefully on that recommendation, they actually recommend outside the hospital blood pressure readings as your diagnostic standard, and maybe we'll get into that today.
Excellent. For the folks who are just joining us, you are listening to Doc Talk Live, and we are discussing high blood pressure or hypertension, as medically known. We have Dr. Mallory Holmes and Dr. Rad Chaudhary, who are experts in hypertension. Dr. Holmes, is blood pressure genetic or an environmental problem?
Well, it can be a little bit of both. We have found that hypertension does run in families, but also there is an environmental component that takes into account your lifestyle and your habits.
And Dr. Chaudhary, if someone says, "Hey, I'm too young to have high blood pressure," is that even possible? Can younger individuals get high blood pressures?
Yeah, absolutely. And I think increasingly we're learning now that there are other causes of high blood pressure outside of just genetics and becoming old. There are other endocrinological reasons that younger individuals may have high blood pressure, vascular reasons or stiffening of the arteries that are outside of just smoking and old age.
And as far as checking blood pressure at home, what are your recommendations, Dr. Holmes?
Yeah, so if you have a blood pressure cuff at home, I recommend that you sit still for about 5 minutes, let yourself calm down, and then go ahead and check your blood pressure. You can actually check it about 3 times and figure out the average and record it and let your doctor know the numbers that you find.
I always tell my patients that please don't watch the news while you're checking your blood pressure because it's never going to be, it's going to be skewed heavily.
That's true.
Or drink a cup of coffee right before checking.
Absolutely, absolutely. And that's the purpose of sitting for a few minutes and relaxing. The other thing is not crossing your legs, while you're sitting.
Absolutely.
That helps also. Dr. Chaudhary, which blood pressure machine or model do you recommend for your patients?
So if you go on the American Heart Association website, there's a link on the website, and I can't remember the link off the top of my head, of validated blood pressure cuffs. But the gist of it is, use a cuff that's for your brachial area or your upper arm, and those will tend to be the most accurate ones.
Excellent.
And the key is to take it multiple times to see the average.
What are your thoughts on the wrist cuffs?
So, once again, going off the recommendations, I would prefer someone use the brachial cuffs, as the wrist cuffs, I'm not sure how validated they are at this time.
Right. No, I agree with you on that. For the folks who are joining us, you are listening to Doc Talk Live, and we are discussing a very important health topic called high blood pressure. If you don't know, Google it. It's medically known as hypertension, and we have Dr. Holmes and Dr. Chaudhary discussing this very important topic. Dr. Holmes, is it normal for blood pressure to go up during stressful times?
Yeah.
And if so, is that harmful?
Yes, your blood pressure will go up in stressful times, but the important thing is that you're not having sustained elevation in your blood pressure. Extreme elevations can actually lead to something like a stroke, but in a stressful time, it's normal for your blood pressure to go up a little bit.
Okay. Dr. Chaudhary, why is it important to treat high blood pressure?
Well, going back to our earlier statement, the reason we want to treat high blood pressure is because we've known that the higher the blood pressure, it has an association with increased things like heart attack, stroke, kidney disease, especially in certain segments of the population, African Americans, older folks. So that's why it's important to meet the targets that you and your primary care doctor, cardiologist, or nephrologist decide on.
Dr. Holmes, what can one do to lower their blood pressures?
Sure. So if you smoke, go ahead and stop. If you're overweight, go ahead and work on weight loss. Also, try to adhere to a low salt diet and just overall healthy lifestyle. Those are some of the best ways to get your blood pressure under better control.
Is there any recommendations, Dr. Chaudhary, on exercise in terms of controlling blood pressure? How much minimum exercise to be done?
Yeah, I mean, I always tell my patients try to get about 20 minutes of exercise in daily. If that's just walking, that at the bare minimum, then you should try to aim for that. And the more you do, obviously, the more will benefit your overall cardiovascular health.
Dr. Holmes also touched upon low salt diet. What are your recommendations to your patients when it comes to salt consumption to control their blood pressures?
So we can't have nephrologists without talking about salt, I suppose. So that's very key. So we know from scientific evidence that salt not only increases your blood pressure, and it also decreases the effectiveness of some of the blood pressure medications you may take. So the recommendation for the amount of salt right now is approximately 2.3 grams daily. Now, that's if you take a tablespoon of salt, table salt, that is usually more than the daily recommendation. So yes, the more you decrease your salt intake, the better effects you will see, positive effects you'll see on your blood pressure.
Got it. Dr. Holmes, okay, I'm eating a low salt diet. I'm exercising just the way Dr. Chaudhary said and maintaining a good body weight. But if I still have high blood pressure, despite of taking several medications, what else can I do or what else am I not doing right?
Yeah, so always readdress what you're doing and so kind of circling back on the low salt, making sure that you're not adding salt to your food and getting fresh fruits and vegetables and sort of living the best lifestyle that you can and also just adhering to your medications. Those are some of the best ways to keep your blood pressure down.
And if I'm young and still undergoing the same scenario, are there workup that I'm supposed to undergo for
Absolutely.
such?
Yeah. So you should definitely talk to your doctor. There are certain tests and scans that can be done to evaluate for causes of resistant hypertension. So the important thing is to establish care with your primary care and undergo the appropriate workup. They may even need to send you to a specialist to have that evaluated further.
Excellent. Again, for the folks who are just joining us, you are listening to Doc Talk Live on 100.7 FM The Word. We are discussing high blood pressure with Dr. Holmes and Dr. Chaudhary. Dr. Chaudhary, if someone's taking blood pressure medications and the blood pressure goes low, and how low is too low?
That's a good question, and there's a little bit of discrepancy on what you consider low blood pressure or hypotension. Historically, less than 100 over 60 can be considered hypotension. Some people will say less than 90 as the top number. One of the key things to keep in mind is when that happens, how do you feel? Do you feel dizzy? Do you feel lightheaded? Do you pass out? And if those are the case, that needs to be addressed with your primary care doctor, absolutely, especially if you're older.
So, Dr. Holmes, if one has or one carries a diagnosis of high blood pressure and is controlled on medications, do they are still at a higher risk for conditions like stroke or heart disease or kidney problems?
So, if your blood pressure is well controlled, you are going to reduce your risk of developing those complications.
Okay, but they still can potentially
They
get these.
absolutely can potentially develop heart disease, kidney disease, etc.
Gotcha. Dr. Chaudhary, how common are these side effects of blood pressure medications?
So side effects from blood pressure medications are quite common. Now, the key is it becomes even more problematic when you're on multiple blood pressure medications. And some of these side effects you may not even realize. They could be electrolyte issues that you're not aware of. They could just be dehydration. So the key thing is to meet with your primary care doctor and have a thorough medication review and be very thorough about what you're feeling on these medications, especially if a new one is started.
Dr. Holmes, are there certain side effects to be truly worried about from these medications?
Absolutely. I would say one of the most worrisome side effects would be what we call angioedema. You could develop swelling in your lips, tongue, throat, and it could be life threatening. So, if that ever occurs, you should absolutely go to the emergency room and be evaluated and be taken off of that medication.
What type of blood pressure medications can potentially cause that side effect?
Yeah, so you typically see that with what's called an ACE inhibitor. So something like lisinopril is the most common ACE inhibitor that we use. So if you're on that medication, it is something to look out for if you start to notice those side effects.
So, Dr. Charlie, still staying on the theme of the medications, someone is watching their diet, someone's controlling their salt intake, someone's exercising, trying to maintain a good, healthy lifestyle, and they're still, their blood pressure is not above goal, as Dr. Holmes mentioned early on, the goals that you want to target. What is the first line of medication that you would prescribe to patients?
That's a very good question. Now, these decisions are usually made when you take the patient as a whole. Um, the more common thing to do now is usually start with a lisinopril also known as a calcium channel blocker. Now there may
Which
be
is, if you
calcium channel blocker, you may have heard of amlodipine or Norvasc, would be the other class of medication that we reach for. In certain instances, we may start with a water pill like hydrochlorothiazide in certain cases of populations of patients. But generally, we start with an ACE inhibitor, lisinopril, or amlodipine, a calcium channel blocker.
And you mentioned that lisinopril can potentially have a very bad side effect like angioedema. Are there any other side effect of these medications, particularly the hydrochlorothiazide and amlodipine, and even lisinopril, or even common side effect, Dr. Holmes, that you can tell our listeners about?
Sure. So with amlodipine, you can have patients develop swelling in their legs. That's probably one of the more common side effects with that medication. There are some blood pressure medications that can cause elevated potassium. Like Dr. Chaudhry mentioned, there can be electrolyte derangements, and those are just things to watch out for on your lab work and also with your legs.
Speaking of lab works, Dr. Chaudhry, when you start them on these medications, how often do you tend to do blood work on them to check for these electrolyte imbalances?
Maybe I'm much younger in my practice, but I'm a little more conservative about this. So if I start someone on a lisinopril, I like to see some labs within 1 to 2 weeks to see how their electrolytes are generally doing.
Mm-hmm.
Same thing, especially if I'm starting for any reason, and I try to avoid this, a water pill in an older patient. I try to obtain labs within a week or two to see what their electrolytes are doing as well.
Okay. How about you? Any thoughts on that in terms of how you would practice and to get lab work done?
So I definitely agree, especially with medications like ACE inhibitors. You do need to watch the renal function just to make sure that the creatinine doesn't rise too acutely and to a greater degree than it should. So it's important to check the labs, and I agree with Dr. Chaudhry.
Are there certain medications that people may take, especially females? Medications like certain oral contraceptives and stuff. Do they tend, for those people, can they potentially get high blood pressure? Is what I'm trying to ask.
Yeah, actually, that's actually very true. There are some oral contraceptives that can contribute to high blood pressure, which is why if you are on oral contraception, you should have your blood pressure checked.
And is that reversible as a diagnosis?
Yes, you can stop that medication or transition to a different oral or form of contraception.
Got it. Okay. Dr. Chaudhry, we talk a lot about sleep apnea and all of that, as potential cause. What are your thoughts on that leading to high blood pressure?
Yeah, so I think I'm going to try to organize this a little bit because there are other causes of hypertension outside of just aging, smoking, and we're learning these and we're calling these secondary causes of hypertension. And I like to put them into 2 buckets. There's essentially the endocrine or the hormonal bucket that can cause high blood pressure. And then there's the non-hormonal bucket, which could be kidney disease. Sleep apnea is a very common one. And sometimes the arteries in our kidneys become stiff when we're younger. So what I'm getting at is we should be cognizant of sleep apnea, appreciate that if we do use our CPAP at night, we do have a higher chance of decreasing our blood pressure and also preventing abnormal heart rhythms as well.
Dr. Holmes, sometimes we're seeing patients in the emergency room or hospital with blood pressure of 200s and 220s and stuff. What are the common symptoms to look out for in such a scenario?
Yeah, so with extreme elevations in blood pressure, you can develop a headache, blurred vision, and just overall feel pretty crummy. So that's definitely something to look out for. And additionally, with high blood pressure, you can have a stroke. So
Mm-hmm.
you could notice,
Absolutely.
you know, sort of a deficit, a neurological deficit with this complication. Yeah.
Excellent. Excellent. For the folks who are joining us, you're listening to Doc Talk Live, and we are discussing a very important health topic on high blood pressure. We have Dr. Holmes and Dr. Chaudhary discussing on this very, very common as well as an important topic. We should be approaching the end of the show soon, but I want to, do rapid firing questions here. In terms of high blood pressure, we discussed about some of the symptoms and some of the dietary stuff. What about herbal medications, or over-the-counter stuff? Any thoughts from both of you? I'm not going to put anyone up on the spot. Are there some good ones or are there bad ones? What are your thoughts on it?
Well, when it comes to over-the-counter medications, I just have to make a plug and say avoid NSAIDs.
Okay.
In terms
Please
of,
tell our listener what NSAIDs are.
oh, sure, like ibuprofen or Motrin, Aleve, Advil. Those medications are not friendly to the kidneys and can contribute to your blood pressure. So I'll just make that plug.
So are you saying that besides oral contraceptive medications, these medications potentially can lead to high blood pressure?
Yes.
And those are reversible causes?
Yes,
okay.
Absolutely.
What are your thoughts on some herbal stuff? You're from South Asian origin. We deal with everything else before we even take medication. What are your thoughts on that?
Yeah, at my house, chai cures everything. So, but so very humbly, I will say that there are so many herbal products on the market that it's hard to keep up. What I tell my patients that are on herbal products, bring them in. You and I will sit on Google. We will Google the side effects and we'll go over it. And I think that's the most best way to approach the situation.
And I think it's very reasonable to discuss with your physician before taking any of these because it might interfere with some other medications as well sometimes. What about type of exercise? Does that matter?
Yeah, I think cardiovascular exercise is probably going to be your bang for your buck in terms of weight loss, in terms of decreasing your cardiovascular risk from high blood pressure. So brisk walking, even getting your steps in, 10,000, 15,000, challenging yourself every day definitely is important.
I agree. Definitely try to get your heart rate up, and just whether that's through brisk walking, like you mentioned, those are some important things that you can do to exercise.
And for the folks who really do a lot of weightlifting and kind of muscle building, any thoughts on supplements that they would take that may potentially cause high blood pressure?
So one of the things, and this comes up every couple of months. I'll see this in my clinic. Anabolic steroids, I think, is a very big abuse of a medication. Anabolic steroids can obviously give you the body that you want at the cost of your blood pressure and cardiovascular health, and that's reversible. The other things to consider is we don't talk about this enough, but illicit drug use as well, cocaine and amphetamines. So you need to be very, very careful about what you're putting into your body.
Excellent. So we are approaching the end of the episode of Doc Talk Live. As you've heard, we have two experts from two different parts of the country, one from California, one from Pittsburgh, discussing high blood pressure. And we will be bringing you another episode next Wednesday between 5 and 5:30 right here on 100.7 FM The Word. And if you want to know the future shows that are upcoming, please log on to our website, doctalklive.com, and also catch us on all the social media platform. If you wish to hear the podcast version of this, feel free to log on to Spotify, iHeartRadio, and iTunes by end of this week, and you'll be able to catch that as well. Dr. Holmes and Dr. Chaudhary, thank you so much for coming on our show. Please, words of wisdom, perhaps for the last minute that we have of the show for our listeners, one at a time, please.
Sure. My advice would just be to develop a great relationship with your primary care doctor. Take care of yourself. Take your medications, exercise, and just do the best you can. I know it's hard.
At the cost of your blood pressure and cardiovascular health, and that's reversible. The other things to consider is we don't talk about this enough, but illicit drug use as well, cocaine and amphetamines. So you need to be very, very careful about what you're putting into your body.
Excellent. So we are approaching the end of the episode of Doc Talk Live. As you've heard, we have two experts from two different parts of the country, one from California, one from Pittsburgh, discussing high blood pressure. And we will be bringing you another episode next Wednesday between 5 and 5:30 right here on 100.7 FM The Word. And if you want to know the future shows that are upcoming, please log on to our website, doctalklive.com, and also catch us on all the social media platform. If you wish to hear the podcast version of this, feel free to log on to Spotify, iHeartRadio, and iTunes by end of this week, and you'll be able to catch that as well. Dr. Holmes and Dr. Chaudhary, thank you so much for coming on our show. Please, words of wisdom, perhaps for the last minute that we have of the show for our listeners, one at a time, please.
Sure. My advice would just be to develop a great relationship with your primary care doctor. Take care of yourself. Take your medications, exercise, and just do the best you can. I know it's hard.